You're listening to the MotherToBaby Podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
Welcome to another episode of the MotherToBaby Podcast. My name is Chris Stallman, and I'm a genetic counselor, mother of four, and teratogen information specialist. So what I do is talk about exposures during pregnancy and breastfeeding, also before pregnancy, and in cases of adoption. And this episode is part of our series on exposures in the workplace, or occupational exposures as they're called. And we're going to talk about a variety of jobs. So things like working in a nail and hair salon, working in the military, working around loud noises. We have so much good information for you. And we have the return of our previous guests. So we have Dr. Jennita Reefhuis, who is branch chief for the birth defects monitoring and research branch at the CDC. She joins us again, along with Dr. Carissa Rocheleau, who has worked as a reproductive and occupational epidemiologist at the National Institute for Occupational Health and Safety for 12 years. Doctors, thank you so much for being back with us today. So now I would like to talk about, if we can, nail and hair salon workers. I recently had a question from someone who works in a hair and nail salon about the smell. And what they asked was if the strong smell in the salon meant that they were being exposed to a high level of chemicals. And I would love to get both of your takes on this issue.
That is a great question. And smell is really not a good indicator of toxicity. For example, you can smell acetone, which is used in a lot of nail polish removers, at a really tiny concentration that's not considered toxic at all. And it can be pretty unpleasant. It can be an irritant at higher concentrations, but it's not actually getting into your bloodstream at those levels. Benzene, on the other hand, smells wonderful. It was popular in the 1800s in men's aftershaves because it was such a wonderful, sweet smell. But it causes cancer and is also likely a reproductive toxicant. So fortunately, we know better today, and benzene is not used in our salon products. But this is just kind of an example that smell is not necessarily an indication of whether something is safe or not. There are still a number of chemicals used in hair and nail salons, though, that might be hazardous. So I recently worked on an analysis of nail and salon workers and hairdressers participating in the National Birth Defects Prevention Study. And we found that mothers whose infants had a congenital heart defect were roughly 3 times more likely than mothers of infants without heart defects to have worked as a nail technician during early pregnancy. This was only based on a small number of moms, so additional research is needed, but it's concerning.
Okay. So what are some of the general recommendations for those who work in hair and nail salons?
Well, my first recommendation would always be improving ventilation. There are a lot of different ways to do that, which could include things like opening windows, making sure the HVAC system takes in lots of fresh air. Local exhaust ventilation is really useful. This is where you have a system that pulls contaminants down or to the side and away from the customer and the employees' faces. So my colleagues at NIOSH conducted an evaluation of several commercially available ventilated nail tables. So this is a surface where there's ventilation underneath the table that people are working at and doing the nails. And it found that these were effective at reducing potential exposures in the breathing zone of the employee by at least 50%.
And I think if you have specific concerns about your work site, discuss them with your healthcare provider or contact MotherToBaby. Your employer really should provide the correct personal protections for all different parts of your job. So be sure to use them even when you're not pregnant. And I may sound like a broken record, but also wash your hands. Do this before and after working on clients. Definitely before eating, drinking, or applying your own cosmetics, and after handling or transferring products in the salon.
At the risk of also sounding like a broken record, I could not agree more, especially just in the world in general right now. Proper hand washing and drying sounds like a great idea overall.
I have been impressed, just as an aside, some of the schools really are doing an outstanding job teaching our children hand washing techniques. I have to say that often my children are better at the proper technique than I am, so I try to learn as I observe them washing their hands.
That's really awesome. Yeah, there's my two youngers are 4 and 2, and even my 2-year-old is excited to get in and make a big mess with the water. I think she likes to splash more than anything, but if I can get some soap on her and off her in about 30 seconds, we're still doing okay.
We do our best.
Yeah, exactly. Okay, let's switch gears and talk about warehouse workers. This is something else that recently I was asked about. Someone was offered a position in a warehouse and recently had found out they were pregnant and was actually asking exactly what I wanted to ask the two of you as well. What are some common exposures for a warehouse worker?
Great question. I mean, prolonged standing in one place, heavy and frequent lifting, awkward postures, and I always throw in a lack of bathroom breaks. Sometimes people laugh when I mention bathroom breaks, but this has been a big issue in warehouses where there are sometimes very strict quotas for products pulled, and bathrooms can be pretty far away. And it's not just an issue of comfort or convenience. For pregnant workers, this problem is amplified. Urinary tract infections are the most common infection in pregnancy, and they're associated with a number of poorer birth outcomes. The best way to avoid a UTI is to drink plenty of water and not hold it when you have to go.
And that's a great point. I know that there had been some mention of, the issue of bathroom breaks, not just with people in a warehouse, but deliveries and later on. And I think it applies everywhere, as you said, to avoid those UTIs, take those steps. What about heavy lifting during pregnancy?
So normal physical activity is healthy during pregnancy, but jobs that involve very high physical demands, for example, bending at the waist more than 20 times per day, frequently lifting something that's heavy, or, frequent awkward postures, or standing in a fixed position all day and not being able to move, are all associated with some increased adverse birth outcomes. It's also important to note that there are some hormonal changes in pregnant women that cause ligaments throughout the body to relax. This allows the pelvis and the spine to kind of give room to the baby to grow. And but they can also, those changes to the ligaments, that loosening of the ligaments, can also destabilize joints. And when combined with changing posture and balance, that could make a pregnant person more vulnerable to an injury. And some of these changes to those ligaments, they start very early in pregnancy. So somebody who's making an awkward lift and an awkward posture could be at a higher risk of injuring themselves. So there are clinical guidelines for lifting during pregnancy that have been published from my colleagues at NIOSH, and we have a link on our topic pages on the NIOSH website.
And really just always listen to your body, right? So if you're pregnant and you work in a physically demanding job, you may want to cut back on or avoid repeatedly stooping, bending, or squatting, and lifting heavy objects, especially from the floor or below mid-shin, lifting things overhead and standing for a long time, as well as you may benefit from sitting down during breaks where you usually may just kind of stand around or walk around. Maybe you should take a break and really kind of sit down. If you work together with your healthcare provider and your employer, hopefully you're able to find a solution that works for both your health and your job.
Okay, well, we're going to stop here with all of this excellent information. And again, Dr. Reefhuis and Dr. Rocheleau, thank you for being here. Can't wait to have you back for our next installment of the series on occupational exposures. Thank you again for being with us today.
Thank you.
And that's a wrap on another Mother to Baby podcast. Thank you for being part of our listening audience today. We really do appreciate it. And don't forget to keep an eye out for the next part of our series about exposures during pregnancy and breastfeeding in workplaces. One of the things we'll be focusing on the next time is the military and military exposures. In the meantime, feel free to catch up with some older episodes of our podcast. You can find us on iTunes, Spotify, or however you listen to podcasts. You can also feel free to contact us if you have questions about exposures during pregnancy or breastfeeding, before pregnancy, or in cases of adoption. You can reach us by telephone at 866-626-6847, by text at 855-999-3525. You can find us on our website, MotherToBaby.org. If you have a comment about the podcast, if you have an idea, if you want to be on the podcast, please feel free to shoot us an email at contactus@MotherToBaby.org. So don't forget to stay tuned. We will have more information about workplace exposures on future episodes, and we cannot wait to have you back. As always, thank you for listening. And remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.